Thank you.
Great. Well, thank you very much for that introduction. And as you can tell from that introduction, I've been in WHO since the end of last year, so it's a short time, but I've worked a lot with the organisation, and particularly with Kumanen's team. And so part of what I'm going to do, I think, is convince you that as we move forward on chronic disease and health promotion, we actually have to move forward through the lens of the social determinants of health, but also primary health care itself. So non-communicable diseases, chronic diseases, are high up on the agenda, but why? As you probably know, at their simplest, they're 4 diseases: cardiovascular diseases, diabetes, cancer, and then respiratory diseases. They have 4 risk factors which are shared: tobacco, unhealthy diet, physical activity, and harmful use of alcohol. That's the simple version. As you probably know from the patient groups you represent, there are a large number of other diseases which are also chronic in their pattern and presentation. But that's really the key focus of where we're coming from. One of the things that's happened in recent years is perhaps the unexpected, that whilst it is felt generally that communicable diseases are actually top of the disease burden in low and middle income countries, actually that trend has been changing. And globally what we're seeing now is that the transitions that communities went through in high-income countries are actually happening in low and middle-income countries, and their pattern of diseases is shifting from having chronic diseases as well. So in fact, globally, the number of deaths occurring in low and middle-income countries from this disease are actually very high, as this shows you, but also that a large proportion of the overall problem is also in low and middle income countries. And this is important, obviously, because of the human suffering it causes, but most importantly, because these deaths are premature. People are dying before they need to. And if we then look at who is dying from these diseases, we find that they are clustering in the most poor communities, just as they are now in high-income countries too. So we're really beginning to see a historic shift in what's happening. Of course, these countries also have the double burden of communicable diseases, but as you'll see as we go on to look at the disease projections, in fact, as communicable diseases go down in these countries, non-communicable diseases will be going up, and that pattern at the moment is set to change, so that in some low and middle income countries, for example, levels of obesity, middle income countries in the Middle East, for example, 60 to 70% of people in communities have obesity. That's going to lead to all sorts of problems with diabetes, which we're already beginning to see. Well, it matters in human terms, but it clearly also matters to the social and economic development of the country. And one of the things that we're doing a lot of work on at the moment is actually to say that this is central to development, it's central to poverty, and it's central to the success or otherwise of these countries in the future. And as you can see, the economic burden of chronic diseases is very high in these countries, and it's going to get increasingly more so. So really, in these days of financial problems and economic crisis, what we're saying is that we move forward, we need to be really clear that economic and social success in the future, reducing human suffering, is going to have chronic diseases at its heart. Otherwise, countries are going to lose ground in terms of economic and social development. So last year, last year's World Health Assembly, the Global Action Plan on Chronic Disease was passed, and I'm going to go through and just tell you what its key elements are. I won't give you too much detail, I'll just give you a flavour of what it's about. It's been a long journey. It didn't suddenly happen last year. It started with an overall strategy for chronic diseases in 2000, and there have been elements building on those risk factors over the succeeding years, with the Framework Convention on Tobacco, Empower on Tobacco as well, saying what are the key interventions, but also the Diet and Physical Activity Plan, culminating last year in the action plan, and clearly we're taking forward work on alcohol and other things which you'll be hearing about over the next few days. So the 6 objectives are really, it's a classic public health strategy. It really says to begin with that we need to recognise that non-communicable diseases aren't just because of individual behaviour. They're about the way governments work, they're about the way our society is structured, they're about the resources people have, and that works on a country level, but it also works on a global level in terms of how resources flow between countries. that if you're going to deal with this as a country, you need a strong programme to do just that. You also need to be thinking about how you're tackling those 4 key risk factors I mentioned. You need to be thinking about what works, the evidence of what works in terms of the research. And you also need to be thinking, because this isn't something that just governments can do, how you really develop effective partnerships across. And you also need to be finding out what the levels of disease are, who's got them, and as you put in place programs, what works over time. So each of those objectives have a number of different response levels, globally, regionally, and a country level. And that was really, in essence, what the action plan said. So I'll take you very briefly through each of the objectives to give you a flavour of what's happened since last year. The first one is the one I mentioned, which is about chronic disease and development. Why, for example, people who have chronic diseases who suddenly have to spend a lot of money on medicines, for example, are precipitating to poverty, how the economic and social development, if people can't work, the country's labour supply gets affected. You can imagine some of the agendas. And we've had some very interesting opportunities to debate these issues. A couple of weeks back, we were in Qatar, in the North Africa and Middle Eastern region of the UN Secretary General's Economic and Social Development Council to talk about development and chronic diseases. We were also in Beijing a week or so before that to talk about the subject of health literacy. That in fact, if you look at all the Millennium Development Goals, but it's particularly true for chronic diseases, that people themselves being empowered, people being given information, but actually having the opportunity not just to be given information, but understand how they can use it in the best way, how they can promote their own ability to engage with diseases is key, and that how this isn't just something that people have to do, that governments need to do this across society and work with a broad range of partners to promote it. And that at the basis of that can be people making healthy choices, but governments clearly have to take responsibility to set the environment for that to happen in. So that was some of the flavour of discussion, and in that debate in Southeast Asia, there was, I think, a strong recognition, very much supported by the Chinese government, that health literacy and giving people the capability to make choices and navigate their way through a health system was really important. This is then coming together in our first global conference in Africa, which is the 7th in a longer series on health promotion and some of the key techniques, getting people, for example, involved in their own health. But at the heart of it is to say that health promoting techniques like community participation work because they're evidence-based and they lead to sustainable change. But as I've already mentioned, the fact that chronic diseases are so linked to poverty means that actually their emergence in low and middle income countries is making it increasingly more likely that the gap between the rich and the poor countries will increase. That, as I've said, they're disabling people at just the moment, whether at peak productivity in terms of their own lives, but also in terms of how they contribute to the wider economy. And as you know, it is incredibly difficult to capture that in real human suffering, which is what motivates most of us. So as we move forward, the second objective was, well, what are countries doing about it and how do we help them strengthen their response? Well, previous surveys carried out in 2005, and we're doing assessment again to present back next year in 2010, show that in fact there is not a lot in place in many countries, and that only a third of countries overall in the world have any action plan to deal with this at a country level, and in countries like Africa the level is much lower. So there are some really big problems, and if you then look at the essential medicines that people need, whether it's from diuretics, as this slide shows, or insulin for diabetes, again the number of people who have access to these medicines is again very low. So we are very much working on a primary healthcare approach about thinking about what can be done, what is the essential package that low and middle income countries could introduce in very resource poor settings, how do we prioritise the interventions. At the moment we're working with about 8 countries to look at the feasibility of those kind of approaches and how we can help them with the reality of where they start from.